I have, for the last 2 years, been working on the project. I'm the project director for the California Reducing Disparities project, the African American Strategic Planning Work Group. And I've actually convened a work group of 52 members that include statewide representation as well as advisors and consultants. And I use an eclectic approach because I believe that wisdom does not reside just in one individual or one group of individuals. So we have a transdisciplinary approach. We have psychiatrists, psychologists, and social workers, marriage and family therapists, anthropologists, but the most important piece is that we have client, family members, and consumers that are equally at the table identifying what is important to them and what needs to be put in place. So we should have a well-rounded population report with recommendations that will go to the governor related to how money should be aligned and what programs and interventions would be more meaningful to people. For 2 years we have worked on this particular project, and for 2 years we've collected data. We've tried to be available in communities and in homes and in places where people meet and places where they gather so that they could be relaxed and be comfortable. And today, the last day of 2011, we're in Long Beach. Today we're going to hear from their perspective what they understand and believe would be important for them in order to have good mental health, what could have happened or taken place or intervened in their lives in order for them not to come down with a certain mental issue. So the California Reducing Disparities project has been an effort to understand better the issues related to mental health, specifically regarding prevention and early intervention. What is it that people of African ancestry, people who are living in America black, irrespective of their nationality, what is it that we need in order to better be balanced, healthy, whole people?
Los Angeles County Department of Mental Health is the largest mental health jurisdiction in the United States. There's over 700 plus contractors. My goals are to see that more implementation is used with consumers that are turned in to contributors, and they're actually allowed to go through, as the recovery model states, with them in control of their recovery process. That means that you have to do things that are not done. You have to utilize a common sense principle. And this is hard to integrate in a system that has already been able to create barriers, deaf ears, blind eyes.
I just hit myself in the head, right here. Take my hand on, you know, boom, do that and I get mad. Because I can't hurt that person, I hurt myself.
The banging that goes on, sometimes it's in our environment, sometimes people feel it in their head, sometimes they feel it in their heart, and they don't know what to do. They don't know where to go or who to seek for to assist them with that. And certainly some people feel like, am I losing it? Is it that maybe I'm not quite balanced in my head? Am I weird? Am I crazy? Or what? When people start having those types of thoughts, and basically many people have those ideas to float across them every now and then, it doesn't mean that there is something wrong with you, but it may mean that you need to talk to somebody about it. You know, as I reflect on this year, it has been a tremendous undertaking to direct a statewide project to try to understand the issues, concerns, and cares of people of African ancestry related to mental issues. It's a very serious topic, and many of our people have not been accustomed to expressing those things that are inside of them. So this project has given them an opportunity to share their voices, to open up, and to seek for a better understanding of how to deal with some of those things that are plaguing them, that they do not feel comfortable with, and oftentimes do not know where to go to find resources.
There was a young lady needed some help, and I tried to point her in a direction, but that was me out there. Then confused, don't know any better. They need to just get all the people that have mental issues. They get the help that they need. And there's nobody that they're scared of us.
And you'll hear in their own voices, and you'll understand from their own perspective. And it's been a tremendous journey for people to travel this road. And it's a tremendous relief to know that other people care. And that the Mental Health Service Act, the funds that have been provided under this particular act, will provide resources and a system that is more responsive to the needs of the black population.
And people want to then call me retarded. My kids don't respect me, you know. But that's life. Life goes on.
Thank you very much. The meeting today is not lip service. This is a reality that we've come to deal with some very critical issues. And I want all of you, and I've talked to all of you personally about today's meeting. And I want to just say, yes, we have time identified on the agenda, but we are having to make these adjustments as we move along, because it's more important that we accomplish our purpose for coming here today. And this is a part of the purpose, the idea of us gathering and being comfortable with each other and being able to be comfortably making commitments and following through on those commitments in order to do what is greater, what is the greatest good that we need to accomplish. And it is not about us as an individual, it's about the collective whole as to how we would be able to collectively accomplish those things that we know that we need to do. And that's what's possibly on your heart, within your mind, or within your spirit that we need to accomplish and to do. So I really want you to understand that this was intended so that you could get into that comfortable zone quickly to move through things that we need to move through. And Dr. Washington also was referred by our Association of Black Psychologists. And I also want to give another shout out to all of the individuals who have lived experiences, professional experiences, and academic experiences, and a whole broad range of experiences that we come to the table to make this thing happen. And it's important for that to take place. We like to acknowledge people who have put in the work and time to do whatever you need to do at your local level and at any other position that you may hold. And so I really sincerely appreciate that. And we need to get comfortable in acknowledging that among each other. I now want to bring Dr. Washington on. And Dr. Wilson, if you could come forward, who is his colleague and friend, to give an introduction to him. So, Dr. Wilson, would you introduce your friend?
Every time I turn around and look up, there is my brother Kevin Washington there. As a nation of Africans across the world, we are hurting. And there's a challenge in this hurt. Part of that challenge is this hurt is to recognize our humanity. And in recognizing the humanity, we begin to see that there's an illumination of a spirit. And it's going to be that spirit that allows us to heal. But as you will see, in his works and his efforts and all the things that he has done, he's a licensed psychologist, he is a healer, He is a drumming healer. He is a spiritual activist. He is someone that comes to you to enlighten you on the understanding of who we are.
10 years ago, think about a theme song that you would have represent you as you thought about elementary school or primary education. As you look around the room, think about somebody. Just think about what, as you see them walk with glasses of water coming to sit to the table, and you see them walk, what comes to mind? What theme song comes to mind to you for them? The question becomes, what theme song went off in your head when you saw that person? Yeah, that's it.
Okay, we're here at the African American Health Institute of San Bernardino Conference here in Fresno, California. Now, Doctor, yesterday we had a great opportunity to see how you do your thing. You began with music and so on. Why don't you tell us a little bit about that and I'll feed it into the coverage from yesterday.
All right, well, the idea behind the activity was to let people know that they all have theme music to deal with the idea of what's happening with you individually, and then also to have people to interact with one another to see what theme music that they have in common, so that we have more commonalities than we have differences. And so that was the main idea behind the activity with the music. And so people seem to share and enjoy that experience of talking about what the experience was with music and their experiences in their lives and how that music became their theme song. What was the experience like? What's up? What's happening?
Okay, my theme song today. Hello, everybody. It's a tune by the Whispers. It's called "It Just Gets Better with Time." Some of you.
Can you sing it? Want to sing it?
Will you sing with me?
No.
And 10 years ago, my song was "I Am Every Woman." And I chose that one because I'm a parent of a bipolar daughter with rapid cycling, and she was diagnosed when she was 14. She started exhibiting symptoms when she was 13, and believe me, puberty and a 13-year-old is a normal thing, and then you add mental illness on top of that. I was every woman. Right. And today it just gets better with time because recovery is possible. Recovery is possible. Sometimes I have to keep my foot on her neck, but recovery is possible, and she's doing very well now. So I'm very grateful.
Thank you. Good morning. Immediately, the song that came to mind was the foundation song, Mother, 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 there's far too many of you dying. Brother, 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 there's far too many of you, mother, 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 there's far too many of you crying. Brother, 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 there's far too many of you dying. You know, we've got to find a way to bring some loving here today. Preach it. Amen.
Thank you. My first song was James Brown, Payback. That would be my theme song. When I was 10 years of age, it would be Smiling Faces. When I got in grade school, it would be Tears of a Clown. And then what just sticks with me no matter what is Brick House.
I don't know karate, but I know karate.
Thanks. My song right now is James Brown. Say it loud. I'm black and I'm proud. I actually had a memory lapse, and my 10 years was actually turned out to be 20 years. So, 20 years ago, I actually was a songwriter. So one of the last songs I actually did was a song called "Get Ready to Roll." Which is tied, it pertinent to what we do because we get ready to roll on this thing. 10 years ago was, I always have my funk reflection of the thrill. So, one nation under a groove. Some George Clinton part of the funk. When I was in elementary school, sing a song, sing out loud, sing out loud. Yeah, I don't know who made it, but yeah. Junior high, Wake Up Everybody. Got that song. And in high school, it's like that. And that's the way it is. So that young teenage energy, when rap was just doing its thing. So yeah, that's it. Thank you.
Okay, hi. I was thinking when he first asked about the song of today, and when I thought about that, two songs came to mind. I really couldn't choose which one. So the first one was I Can Fly. You know, when I look around at the things going on in my life personally and the people that I encounter as we do a Growing for Success program down at Skid Row, and I encourage the people to be mindful that you can do it, that you can rise up. And every time I'm encouraging them, I'm encouraging myself too. And then the second song that really came to mind was Say What You Need to Say. And so as we here in this room and the people that I encounter, we need to be mindful that what we have to say needs to be heard. And it has significance, and it's come to us for a reason. So we need to say what we need to say and not hold it in. And a lot of times that creates mental illness. When we don't say what we need to say, you know, we hold in the air, and pretty soon we just keep holding things, then we blow up. You know, so if we say what we need to say, we can get it out there, and a lot of people identify with that. It helps so many people.
And it's called Keep On Climbing. Just keep on climbing until you reach your goal. Just keep on striving with all your heart and soul. All things are possible with God, so don't give in. He'll move your mountain. He believes in your something. Dawned on me while I was listening to everybody, my full name is Denise Renee Hines, and so my initials are DRH. And so my father used to tell me as a kid, you're meant to be a doctor. That's why your initials are DR. You're going to be a doctor. It's meant to be. You have to be. And so while I ended up taking the long road, it wasn't an easy road, but you know, I was able to make him and my mother proud a year and a half ago by finally reaching that point. So, and not only is my name that, and Dr. Hines, the degree itself says DRPH.
The only one that I wanted to mention was, and I couldn't think of the name of it, was Gil Scott's song, When the Revolution Comes. And I really believe, and a lot of my friends don't, that we're at war. Yeah. And it's a plan war. Yeah. And my friend says I'm a conspiracy theorist. No, they have planned and they have targeted us. Right. And I don't care how many people tell me that I'm crazy. No. I know it's the truth. And we got children made on the
The idea is that we're always moving with things, and everybody has some meaning in their lives. The idea of a brick house, and I believe I Can Fly was mentioned, someone mentioned it here, but it also was mentioned to me earlier, and overcoming things, and Marvin Gaye, in a time frame, and people began to understand their lives, make meaning of their lives through song, and also just beginning to use song to understand what's going on right now. So anyway, the theme song, I thought about this another way too, because the bass player for the 10-12, he did all that Motown music. He actually, oh, hold on, let me do this. So y'all heard that song before. What I thought was cool was when I heard about how the brother came up with the song. He was getting off the buses. Well, he was getting on the buses. What the pictures again? His brother was getting on the bus. Sister was getting off the bus. As he watched her walk away, he heard doom doom doom. No. Well,
he saw her hips move.
I'm just saying. That's all I'm saying. And that was one of the elements that we brought out yesterday, is that we have empowered, we've helped, by doing what Dr. Wood has created here, we've helped others, such as the Okinawans, to claim their independence from the oppression that they had in Japan. When we talk about the brothers who were in the military in the 70s, who took the Black Power movement over into Okinawa, and then the Tiananmen Square issue in China, they used the civil rights movement as their foundation. Also in South Africa, we talk about the apartheid movement in '76. It was based on the challenges that African Americans had faced here. So I think we're in the same similar position with this event, is that what's happening here in California that Dr. Woods is actually spearheading at some level, or energizing, is going to resonate throughout the entire country and also begin to resonate throughout the entire world.
So what's the issue? The issue is what?
And as an epidemiologist, one of my primary concerns is looking at inequalities in health outcomes, and also coming up with effective strategies of closing those. A couple of comments that I have is, number one, the title of the table puts some onus on us. It says that we are recommending these organizations and that they meet their community-defined practices that we have established. And what I'm hearing is that that may or may not be true of organizations in this list. So first of all, then, we have to look at this title. And perhaps these organizations have been identified, but whether or not they meet a community-defined practice criterion is something that we need to look at. Also, one of the things, I had the opportunity to teach U.S. health care in the United States. One of the interesting things with mental health in our current system is that, of course, we know we have increased need, and how our country is choosing to meet that need is by having providers who are not mental health providers, but regular clinicians, physicians, nurse practitioners, PAs, etc., providing mental health services. I'm not sure that that's what our community needs. Number one, because they're not specifically trained to do so. So we have decreased time provided by these providers, and they're noting that there's increased visits, encounters. So there's a problem with how the care is being provided, in that providers are not specifically trained to provide mental health services. So do these agencies provide services by providers who are specifically trained in mental health care, and also do they meet the criterion for African-centered mental health models, practice? So I'm agreeing with Dr. Goddard that we need some way of evaluating, number one, these agencies, so that's independent of the work that we've currently done, taking on another task, and that is verifying what these agencies are providing so that we can recommend or not recommend, and also that we develop a tool for consumers so that they can evaluate. So when they call, they have a tool that can that may provide them some talking points or some questions to ask about the agency, so they can also decide for themselves, does this agency really meet my needs? Thanks. That's good.
General Jeff.
My name is General Jeff. I'm a Skid Row community activist, and so I represent the people in Skid Row. So when I look at this list, I see a lot of I'm very outspoken against the Skid Row nonprofits, because they definitely have a nonprofit hustle. There's a whole lot of poverty pimping going on, and they're not helping the people. So when I look at that list and I see a whole bunch of Skid Row nonprofits, I'm pissed, because I know my constituents, I can't give them this list to sit there and say, hey, these are some recommended folks that you should go talk to. But on the very other hand, these are the same people that I'm basically because they're not doing what's necessary. So I'm hoping today in this room we can come away with the actual necessary, realistic filter to weed out, the truths from the naysayers. And so, basically, I definitely want to add that, with this being an African-American project, African-American talking about black folks, to me, the simple solution would be, if there's going to be a list, it should be about either African-American led or African-American based organizations and social service providers, because my whole thing is in Skid Row, there are no black social service providers other than Hill Bar people. That's the list I'm looking for. That's the list I'm looking for. And if my name is going to be on the list with some of these Skid Row poverty pimps, you can take my name off.
Yeah. Wow.
When I look at this list, a lot of these programs are programs that definitely do serve African Americans.
but they're not necessarily operated by staffing that have the skills base to serve them in an appropriately, a culturally responsive manner. So just because they serve them in Alameda County, 60 to 70% of who we serve are African Americans. Many of these listed are the higher, more restrictive, no choice. You are, costing us so much money, you need to go to this program. And so their names will fall on there. I have a hard time with lifting up programs that I see here just because they serve African Americans. I would think that the goal would be to identify ones that are even have a plan toward serving them using community-defined strategies. These programs here are not using community-defined strategies at all that I see here for Alameda County, one or two. So the ones that say we're working toward that, I have no problem with using those. But if they're just a program that serves black people, that's what we've always had.
If there's something that we missed, this is the time that you tell us that we have missed it. Yes, Gigi.
On this particular table,
yes.
Now what if we identify programs on here that we don't feel like are honoring African American responsive practices, but they're listed here?
They're listed. Good question too. What you have listed there is what somebody submitted. Okay. We did not have a selection criteria because we asked them in their opinion. This is what people gave us in their opinion. And so what is listed is what people say they believe. So in the paragraph before this table and before this section, that's what we said, that this includes information that is the perspective or in the opinion of individuals related to whatever it is that they put there. And we've had that to come up before where someone did not think that something was on the list that really represented what they felt was helpful to black people. But whatever is on the list is what someone among our people have recommended.
And I agree with both ladies because I see some groups out here that, of course, I would approve of. But I think that all that needs to be added, does anyone have any objections to any group? Put like a warning, that, disclaimer, that some people feel that it's not necessary. I wouldn't say take anybody off, but to add that on there.
One of the greatest challenges is going to be defining what a community-defined practice under community-defined evidence really is. Yeah. The general definition that was developed by Ken Martinez and that group of folk has a broad understanding of what community-defined practice is. And so if you're using that definition as a standard for how to evaluate these particular practices, they could be communities in and of themselves. They can be communities within an organization, they can be communities within blocks, segmented by regions and people who live in a particular region, or they can be communities by ethnicity and race, and or by culture. And so that definition is just all over the place. And it's hard to really look at a list and say this particular group doesn't match that particular definition if they consider themselves to be a community. Because if they created it within the context of their community, then it's community defined. And so on some level, if you're using that formal definition, I was trying to look through the book. I know in the early stages of these documents, that was the definition that was being used. I don't know if it's evolved since then.
It's still there. If no one made a comment on it since I typed it, I know that it's still there.
Yeah, I tried.
So then the recommendation that you are making is related to looking at that definition?
It's challenging. It's challenging if you decide to try to exclude practices in particular settings because you don't like, their configuration and what they do. Because they can define themselves as a community as they see fit.
As I look at this list and I consider some of the organizations that I've come in contact with to help those with mental ill issues, and my question is always, how much of the funds that they're given are actually being spent on helping the people? And do we have, or have we considered putting in place an accountability outline to take a look at some of these organizations to make sure that the majority of the funds that are being received are actually helping those who are in need and not just going towards paying people with large salaries with different degrees that a lot of the funding requires that some of the organizations or centers or so forth have to receive the funding. We need to make sure as we run our organization and as we deal with those who do have organizations that receive a lot of funds, that they actually are putting the majority of those funds towards helping the people and not just paying the staff. Because I think that's one reason why we don't get as much help to the people. There is no real accountability in place to say we're going to spend 70% of this money on helping the people and not 70% of this money on paying the staff and only 30% of the money helping the people. So we really need to consider how we can put an accountability program in place to make sure that the people that we have a heart for that we're servicing are actually receiving the service that they need.
It seems like accountability and transparency, is looking for its high water mark here and whatnot. And I got to take a survey here. How many of you know about Title VI, the Federal Anti-Discriminatory Act of 1964? Comparatively few. But what this does is for the distribution of federal dollars, and from all these departments, agriculture, commerce, housing, and everything like that, Title VI requires that these monies be distributed to protected class people. Now, are we familiar with that term? That's us. We are protected class. Single mothers, the handicapped and whatnot. And if you did any investigation around this nation, around California, you would find that there's a huge disparity, a total lack of compliance of having these money distributed where they need to go. And this is a tool that we should put in our box, because there are millions of dollars out there that are not reaching their target population. And the state has also additional, they don't call it Title VI, but requirements. They extend that list of people who need to be the beneficiaries of this type of, funding. So, somewhere along the line, we need to have a conversation about Title VI. What we're doing up in Marin County is we have an organization that is, we convene an organization to challenge all the policymakers, including community development block grant money that's supposed to come to us. We're challenging them. We're going to make them get up off of a dime.
Thank you.
That the power for any change is in this group right here. And I think this group certainly has spent a great deal of time developing key strategies that is what the communities need. You can use that as a blueprint to really evaluate every program and ensure that if they don't have it, that they develop it. If they don't want to develop it, then we would say, thank you for your effort, but we sanction these activities. It's not that we wouldn't and shouldn't invite more to the table. We should have this list even larger. But if we develop a peer group of individuals that's been working in this program, and they can go review each program. They can identify all the strategies that you think are really important and really be sure that either people can learn how to do it or they're already doing it.
Since they don't want you to have it done, they already got legal advocates. And they already have their agendas set. So while we're talking about programs and all these great things, we need to talk about legal advocates to protect our interests. Yes. We do pay taxes. And we need somebody to be speaking up for us.
Amen. So, legal advocates.
So basically, when you look at the communities who are actually smaller in population, who have had an impact, who do have their own funding sources, like the Native American
communities, it's because they had lobbyists and they had representation at every level at the state, and they were able to strategically come up with plans, and they modeled something that we can model, and then the Latino population has made a lot of progress in terms of hiring, who they have at the state. I go to statewide meetings, and often there are no African-American males in the room at all. Part of the reason I will share, because I'm a transferring person, I'm on administrative leave now, and I'm speaking as a private citizen, is because over the last 3 to 4 years, I had to put a strategic plan in place to identify my allies at a state level, at a local level, etc., so that an issue that came up could be something that I could firmly stand on to challenge my department. I couldn't do that if it was just me. I had to do it once I was well positioned. Unfortunate what happened with Trayvon Martin, but it helped me out because of the climate in the country. Unfortunate what happened with a lot of situations in Oakland around police action, because I was advocating for a family member and her desire to speak to cops about the issues for African Americans when they make a 5150 call. We're federally sanctioned in Oakland because of civil rights violations. So timing for me was everything. I'll take paid administrative leave because I'm using that time to work with 100 black men to build a school specific for African American males. I wouldn't have been able to do that while I was on the job.
Yesterday, the African American Reducing Disparities Strategic Plan Work Group, plus their advisors, their consultants, and more importantly, client family members came together to look at the 274 recommendations that we were able to gather from all of the data, from our focus groups, from our interviews, from our town hall meetings, from our surveys, and actually identify action agenda. How do we want to move forward in the state of California? So we made many commitments to each other, but there are 3 that we want to highlight. And number 1 is the fact that we are coming together in a unified manner to create a mental health commission, a black mental health commission, so that together across the state we will work on very specific issues. Number 2, there are tailored programs such as the Village Project in Monterey, tailored programs such as Alameda County with the ethnic service managers, Gigi Crowder, is working with the black men on multiple problems, 100 black men of Alameda County, and Black Men Speak, and other projects that they're involved in. And these particular approaches of allowing our people to craft interventions for outreach, for education, for service delivery is effective and is working and is proven, and we need to replicate those particular strategies throughout the state. And then thirdly, I'm very proud of the Skid Row Positive Movement, Blaze, for which you are part of that with the Skid Row Photography Club. We have General Jeff always going with Advocacy. He's gone with us at the state level. He's gone to Washington, D.C. He is all in the community, as you know, trying to bring the positive image of black people in Skid Row and what they're doing in order to improve their well-being, and also advocating to get more assistance to come in and to make services and programs more appropriate, especially the one related to housing. Some of the foundational issues that will affect our self-esteem, that will affect our mental cognitive ability, that will affect our energy, and it affects whether or not we are displaying signs of depression, and whether we exhibit that idea of hopelessness and never moving out of our situation. So what I'm proud about the Skid Row activity, Positive Movement, is that you all are with us here, and you made the commitment to come, and you go with us to share what you are doing there, because before we did this project, it was not even known about the Positive Movement in Skid Row, except for those who were actively involved in it. And then third, I have another third program which I think is very, very important, and that is we have high incarceration rates. And so one of the projects that is actually recommended is coming from inside of the prison. We have prison inmates that are actually reaching out into their communities through a letter writing campaign to actually address high-risk youth, to let them know and to share with them their ideas about how they cannot
get into the trouble that they get into, the choices that they make, the decisions that they make, and that they have other choices to make, and they show them what those choices are, so that they do not end up in the penal system. And what we have heard is real examples of where you have kids that are in kindergarten that the teachers feel like they are exhibiting uncontrollable behavior, that they call the police to come and get the child and take them to detention. Kindergarten. Now, what is that? That could be the fact that the teacher does not know how to relate to this child. The child is trying to express, coming out of an environment where maybe there is loud talking and verbal conversation and everything, and the teacher, is that teacher actually misunderstanding that? Or is it inconsistency, is incongruent with what they understand about the culture of the children that they're dealing with?
A point where you felt like, well, I'm getting better.
For me, recovery was feeling better about myself and feeling like I was able to meet the challenge of an everyday life and feel more independent of having to depend on services that were given to me through the hospital.
I actually am getting better.
I had been hospitalized for a long, long time. By the grace of God, He was there, my strength and my hope. And I tried to hold my sanity down by praying, going to church, talking to people that know what I'm going through. That's how I get over my my diagnosis and stuff like that. Thank you.
Okay, so in other words, when you're feeling a little down, you know where to go.
Yes.
So at a time when you felt like, well, you know, I'm getting a grip on this.
My name is Sharon Leo, and I felt like I could handle my situation. I was about 40 years of age when I realized that I am more than a diagnosis. I am more than someone else's limitations. And what I decided at that moment was to not allow myself to be subjected to another person's limitations. I can move beyond perceived limitations. I need assistance. I'm legally blind. I suffer from a condition called keratoconus. I'm deaf on one side. It was from an aneurysm approximately 12 years ago. I've dealt with issues on a multi-generational basis. I have strong family ties. I'm a great aunt. And my venture into the mental health system, I started into that process because I found out there were different behaviors that I didn't want to deal with myself. So when I went in, I was seeking help. I wanted answers. I looked for information. I received a lot of literature. I did a lot of reading. And when I started the reading, I found out that after following their guidelines, the system really is broken. It doesn't really allow for individuals to take control. Even though it is a recovery model, it's been limited for some consumers. I have just challenged it on every aspect because I do know me. But getting in a place where the Department of Mental Health actually respects consumers and elevates consumers to a point of they can transcend from consumers to contributors, it's not quite there. I continue my advocacy on a systematic basis because I'm allowing consumers to meet the needs that they are aware of, and I'm trying to educate service providers and administration that individuals that suffer from mental illness, they're not completely stupid, they're not without vision, they don't lack courage, they're survivors, and you have to treat survivors in a manner of how they work well with the world.
Hopefully, in the next 10 years, as I look into the future, we should have less visits to the emergency room, where people come in crisis. We should have less long-term stay in medical facilities as well as mental health facilities. We should have less children being taken to detention and less children on medications that are not intended for long-term therapy, psychotropic drugs that really should be given with caution to adults. We should have a thriving California where people are quantum leaps above the current status quo. Less depression, less suicide, less loneliness. We should have a society where people are productive and feeling their optimal best. That's what I'm hoping in the next 5 years and 10 years.
And you mentioned several times that throughout your experience in life, people have disrespected you unnecessarily just by looking at you. How do you deal with that?
Well, how I deal with them, look at them, keep smiling, God bless you, keep on stepping.
I'm going to end with that. That's powerful.
Hey, bye.
Thank you.